This is a quick presentation on antihistamines, which one to use, when and why. There is a whole range available on the market. Typically in South Africa, quite a few over-the-counter medications are antihistamines, and it's sometimes difficult for the average patient and member of the public looking for self-medication to know which one to choose. And so this presentation will be a cursory glance at these medications to help anyone make a bit more of an informed decision regarding the various options that are available, and to just make a decision that's maybe better or at least more informed. So let us go to the first. So how do antihistamines work? Their mechanism of action involves mainly the blocking of histamine receptors. Histamine is a naturally occurring endogenous molecule that gets released by our mast cells. And so antihistamines work by blocking histamine and therefore preventing histamine from performing its action. Typically, the histamine receptors we are talking about are H1 receptors. H2 blockers also exist, and they serve a different purpose, more in the gastrointestinal tract. Older generation of medications for conditions like ulcers or heartburn are in view there, but this is not the focus of this presentation really. We are focusing on allergies and all the other various purposes people will be using over-the-counter antihistamines for, the medications that typically come to mind when people speak about antihistamines. And so the big main mechanism of action, the big thing to focus on, is the blocking of H1 or histamine 1 receptors. Some antihistamines on the market also reduce the release of histamine, or prevents the release of histamine from the mast cells, and these are called mast cell stabilizers. Or an additional mechanism of action is the stabilization of mast cells, and one of the examples that I can mention is ketotifen, used in either an oral medication. There's a syrup called Zetofen, that's a brand name, as well as there are medications like eye drops that contain ketotifen on the market as well to prevent allergic effects on the eyes. So let us move on. The first generation of antihistamines are very common medications, still widely used, either on their own or in combination with other active ingredients in products that fix those combinations, etc. These include drugs like chlorpheniramine, diphenhydramine, promethazine, doxylamine, cinnarizine, and they are typically lower cost because they are older. There are many generic brands available. In South Africa, chlorpheniramine is the most commonly known as Allergex. That's a commonly sold brand. And then diphenhydramine is more commonly found in combinations in other flu preparations or cough syrups, but it is sold on its own, but we'll get to that later. Interestingly, not as an anti-allergy medication or something for urticaria. The main drawback of these medications are their side effects. They have greater central activity, leading to side effects such as sedation or drowsiness. And they also have some notable anticholinergic effects, and this involves effects such as dry mouth and the drying up of the nasal passageways. Something people see that as a benefit, but largely it causes thicker mucus, etc., because of the drying out of nasal passageways, etc. They are, however, useful to treat some other conditions because of their central activity, and this includes use as antiemetics in promethazine's case, for example. Also in the case of cyclizine, this is not one that I had listed before, but cyclizine is an antihistamine, most commonly sold as a medication to treat nausea. Cinnarizine is commonly used for motion sickness as well as nausea, and so these older generation antihistamines have still found great use as affordable and accessible over-the-counter medications to treat a variety of conditions. Now, when it comes to the newer generations of antihistamines, medications like loratadine, desloratadine, cetirizine, fexofenadine, ripatadine are commonly now sold as preferred medications for allergies or allergic rhinitis or urticaria, and they have reduced, less notable central activity in most patients. They are less likely to cause drowsiness and sedation, and therefore can be taken at any time of day. So that provides benefits to patients. The main drawback of these medications are that they are more expensive, but the cost, at least with some of them, the cost is partially offset by the fact that you only have to take it once a day, and the convenience factor also plays a role. But there are generics available that also where the cost is reduced. Loratadine is of the newer generation an older example, and there are very affordable options available. For example, cetirizine as well. Cetirizine's original brand is called Zyrtec. However, in South Africa, the brand Texaten is probably the most well-known, but there are also a variety of other brands available. Fexofenadine is a more expensive one, for example. Great effectiveness in most patients when it comes to treat urticaria. And a common brand typically sold in South Africa is called Fexo. And ripatadine, original brand in South Africa, Rupanase, but there are a few other brands available already. And all of these find their niche and use with patients who suffer from seasonal allergies, or maybe the side effects or the effects of irritation of the nasal passageways when they have colds and flu as an additional adjunct therapy. These are very useful. Due to this, the reduced central activity, however, they do not find other therapeutic applications beyond the treating of allergies and rhinitis and urticaria, things typically associated with the peripheral effects of histamine. So this brings us to our final slide, where we consider which one do we choose. And as a pharmacist, my advice generally is for hay fever, rhinitis, allergy types of conditions, a newer generation is preferred. If it's going to be orally taken and systemically acting, take one that has the reduced side effects. And then if you can afford it and if it's available, a newer generation antihistamine would be preferred. But older generations are definitely useful because of their lower cost, for one, and then also because of their other effects. If you need an over-the-counter antiemetic, really, an antihistamine will be the only option available to you. Otherwise, you'll need a prescription for anything stronger. In the South African context, that's the context from which I'm speaking. Cyclizine is really the go-to over-the-counter antiemetic. If you need something like metoclopramide or ondansetron, any of those types of medications, you'll typically require a prescription from your doctor, and that may not always be an option. So if you just need something quickly, that is available. As a sleep aid, both doxylamine as well as diphenhydramine are available and are used for this purpose. They are registered indications in South Africa for these medications, and again, better to have something available than having to get something on prescription that may have other drawbacks. The stronger types of hypnotics that are available, sedative hypnotics, have dependency risk much greater than the antihistamines, and therefore these older generations of antihistamines still have a niche and a specific application that remains useful to treat various conditions. And so that is my presentation on the various antihistamines. It's a very short presentation, but hopefully it can be useful to you.